Hey guys, this is Dr. Hub. Today we look at the CTEV and the order of correction of the deformities. So to begin with, the order of correction of the deformities in the CTEV. So CTEV, we know it is a congenital talipes equinus varus. So here we start with the correction of the forefoot. So there is correction of forefoot. So correction of forefoot is by the AD. AD stands for the adduction. Adduction, which means the towards the body. Next, there is correction. So next correction is of the heel. Correction of the heel, that is a varus. So we write it as V. Next is the correction of the hind foot. So it is a correction. And this is of the hind foot. So hind foot equinus. So this will be E. So first is the correction of the forefoot, adduction. Next will be the correction of the heel, that is a varus. Next is the correction of the hind foot, that is a equinus. Then this order is followed to prevent the rocker bottom foot. So this is followed to prevent the rocker bottom foot. Rocker bottom foot, which develops if it is dorsiflexed through the hind foot rather than the midfoot. So in terms it is dorsiflexed. In terms it is dorsiflexed through the hind foot. So it is dorsiflexed to the hind foot rather than the midfoot. So to repeat what we did, the correction first will be the correction of the forefoot, that is by adduction. Next, correction of the heel, that is varus, and then correction of the hind foot, the equinus. And then the order is to be followed to prevent the rocker bottom foot, and in such case it develops if it is dorsiflexed to the hind foot rather than the midfoot. To learn and grow daily like this, please do subscribe.